Skin cancer is the most common form of cancer, with 1 in 5 Americans affected. Joining us now to teach us how to reduce our risk is Dr. Thomas Brown with the Orlando Health Cancer Institute. Thanks so much for being here with us today.
Thank you for having me.
Okay, so the only thing we've heard for years and years is wear sunscreen all the time, every day. Is that still the best course of action?
Absolutely no, and there's data to prove that the sun and UV exposure is the main factor in the development of skin cancer. Here in Florida, we get sun all year round, many hours of the day, so sunscreen is very important. But what I tell people is that should be the last line option that we use to protect our skin. So you want to, seek shade, avoid the sun as much as possible, and wear protective clothing, and then apply sunscreen to the exposed areas.
How effective is that clothing? They call it UPF, or ultraviolet protection clothing. How does it work, and does it work well?
Yeah, absolutely. You can think of it interchangeably, UPF for clothing, SPF for skin. Think of them interchangeably, like the numbers essentially mean the same thing. And what the number means is it's a factor of how much UV radiation is reaching your skin, whether that's coming through the sunscreen or it's coming through the clothing, how much UV is being filtered out. So SPF 50, for example. Let's say me, I'm pretty fair-skinned. If it takes me about 10 minutes outside to get burned without sunscreen, SPF 50 means I can spend 50 times longer in the sun to achieve the same burn level.
Okay.
So about 500 minutes or just over 8 hours it would take to achieve the same burn. The trick with that is we know in the real world setting, sunscreen does not last 8 hours on your skin. We sweat, we secrete oil. So that's why it's important we reapply every 40 to 60 minutes if we're very active, or if you're just kind of laying there or doing routine stuff outside, at least every 80 to 120 minutes
Okay, so the best medicine, as usual, is prevention. But if you do start to notice some spots on your skin, there's a science to being able to identify the ones that might be problems. So can you just kind of go over the guidelines with us?
Absolutely. Really anything that's changed, that's the name of the game, to see a dermatologist. We are the experts when it comes to hair, skin, and nails, and especially skin cancer. Spots can be totally normal. That's why we go through so many years of training, training our eyes, using different devices. We have what's called a dermatoscope, which is just a 10x magnifier with an LED light that we can examine more closely individual lesions that stand out to us and say, hey, is this something to be concerned about, or this is just a sign of aging.
Get an annual check with a dermatologist, right? Have them take a look at everything. Great information. Thank you so much, Dr. Thomas Brown. We really appreciate it. And if you would like more information, you can visit orlandohealth.com/cancer.